All right. We've got a couple people coming in. Um, got one person so far. Hi, Julie. Hopefully you can hear me. This is Trisha. We'll probably give it a couple more minutes. All right, we've got Tamala coming in. So thanks for joining today. Great to have you guys. Give it a couple of minutes. All right. Yeah, we're getting more now. Yay. Excellent. Thanks for joining us today. Yeah, it's been nice. The weather's been beautiful here. With although I wasn't really happy with the 80 degrees, and now that it's cooling down, it's been wonderful.
Oh
So
yeah, the clouds were
nice.
beautiful today.
I know. I just hope we don't go from like winter to summer. Like I really want spring in here. All right, we've got one more person. We've got 3. I know we have almost 30 registered, but because this is on demand,
Yeah.
oftentimes people, don't have time to join at the moment, so they watch it on demand. So, which is really great for our webinars. Yeah, so we've got 3 people, Denise, and so I'll just kind of get started here. And for those of you who have joined, I have unlocked the chat so you can chat with us with myself and Denise. You so also know, be mindful that this is recorded. So if anybody has any questions, be thoughtful about any privacy concerns because this is being recorded. So feel free to ask for a friend. And we'll make it a little interactive. So Denise might ask you to drop things in the chat. You can also raise your hand if you want to answer a question that way, or at any time you can also put something in the Q&A. So if you've got the Q&A open, any questions, feel free to put them in the Q&A. I'll be checking that out every once in a while. And then the chat for any interactions that we have. All right, we've got another person joining. Awesome. Okay, so I'd love to introduce our spotlight speaker today, Denise Jauregui. She is a licensed clinical social worker and founder and CEO of Cultivando Wellness, an organization that strives to increase awareness about mental health, to destigmatize the use of mental health services. Denise is a licensed clinical social worker who specializes in mental health services and training. She has experience providing individual therapy, group therapy, family therapy, and mental health trainings and presentations. She has worked with different communities and populations, including refugees, immigrants, children of immigrants, victims of sexual exploitation, people struggling with substance abuse disorders, and those involved in the juvenile and adult justice systems. So again, Cultivando Wellness offers mental health services, community outreach, and education for businesses and other medical professionals. And I will now hand it over to Denise.
Thank you. So I can't really see you guys, but I will be seeing all your responses through the chats. You can send any Q&As. It's nice to be here and share this important topic. So feel free to ask any questions at any time. I will be going and giving some time for you guys to participate. I like this to be a little bit more interactive, more like a conversation. So let's get started. Okay, so objectives. We're going to understand the difference between mental health and mental illness, learn about some of the different mental health problems and the signs and symptoms of mental health illnesses, and just a few ways to take care of your own mental health. starting with the prevalence, how much do we see mental health? I don't know how familiar you guys are with the statistics in the United States or in the world, but 1 in 5 Americans will experience a mental illness in any given year. So that means in a group of 5 people, at least one person is struggling with mental illness at some point in their lives. So 1 in 5 children as well. So either currently or at some point in their childhood life, they've had a seriously debilitating mental illness. In 2019, 1 in every 8 people in the whole world were diagnosed with a mental health disorder. So throughout that year, at least 1 in 8. Then, the pandemic, 2020, this increased 26% and 28% for anxiety and major depressive disorders. These two are the most common mental health disorders out there. So that explains, after or during the pandemic, this really went up. Recently, there was an article released, I don't know if you guys saw in the news, about how kids with mental health is in crisis. Right now, they are recommending that there are screenings for youth ages 8 all the way to 18 for anxiety and depression 12 to 18 years old. So here are some terms that we will be mentioning today. I will use this slide for you guys to let me know in the chat, or if you have any questions so far about what you guys have heard about mental health. If you guys are familiar with mental health, know somebody struggling with mental health, anything you want to share that even any type of myth, or I've heard this, and any type of thing you've heard about mental health, feel free to share in the chat, or if you want to mention it out loud, you're welcome to participate. Okay, so mental wellness, thank you. Yeah, comes from trauma. I like that. It is definitely, there's a lot of reasons why people struggle with mental health. And we will start defining mental health first. So mental health is a state of mental well-being that enables people to cope with the stresses of life, just learning, working, the people around them. So this is how they contribute to their community. Basically, mental health is just like physical health. Like, how is your physical health? Oh, pretty healthy. How is my mental health? Oh, it's pretty good. Or I've been struggling. Everyone has mental health, and it's more about, is it healthy? Is it not healthy? Has it gone to the point that now it's become mental illness? So it's important to know that mental health is a term that we can all use, because it's important to take care of it, just as it's important to take care of your mental health. Now, mental illness, a lot of times mental health, mental illness are used interchangeably. But like I said, mental health is just, what is your mental health? Like, what is it looking like? And mental illness is once that is diagnosable. So once it's impairing your everyday functioning, maybe you're struggling at work, maybe you're struggling in your relationships. So once it becomes severe in that way, and it's affecting your social, your work, your daily activities, that's when it becomes a mental illness. And it's important to know that for some people, it can be a chronic, a lifelong illness. For other people, it can be, something happened and now I fell into this depression or anxiety, but it can go away. So just like the common cold, we're sick. Yeah, I'm ill right now. I am struggling with this right now, but I can overcome it. So that's an important thing to keep in mind. So 50% of mental illness begins by age 14, and 3/4 begin by age 24. So a lot of times, I don't know, any of you have kids or know any teens, it can be a pretty difficult age for them. A lot of changes are happening. This means that it can be normal, natural, part of hormones and the life stages, but also, it's important to know the difference. Is this just a normal teenager, going through all these changes, or is this mental illness? So it's important to know that around that age, it's possible that the onset of mental illness could be happening. Any questions so far about mental health, mental illness, or any of the statistics I mentioned? I know it's a really small group, but feel free to ask. If you guys don't want your answers to be seen, you can always send it through the Q&A, and those only come directly to me or Trisha. Okay. So these are some examples of mental health disorders. You guys might have heard of some of these. This is just, some of them, and some of them are grouped. So like anxiety disorders, major depressive disorder, we know it as depression, but the clinical name is major depressive disorder. There is bipolar disorder, which is a combination of depression. So it looks like the major depressive disorder, but also like either mania or hypomania. So it can look like someone that is depressed for a long time, and then they have bouts of, moments where they're more energetic, more happy, or it could be even more irritable, but it's just a lot more energy, a lot more, very different from the depressed state. So bipolar disorder is one that can be very stigmatized, because when it's a mania, it can be, very extreme, but it's not always that way. So it's important to know, is it type 1? Is it type 2? Because it can look like someone that has depression, but they have a few days or a couple weeks where they're more energetic, they're getting things done. PTSD, post-traumatic stress disorder. Yes, disorders are the same as mental illness is when you're diagnosed with a mental health disorder. So yes, once it's mental illness, it's okay, now I have this diagnosable disorder, and now I'm struggling with this. But of course, I can learn to manage it. I can get better from it. For example, PTSD, it comes from a really strong traumatic event. I don't know if you guys have heard, military, this is one of the disorders that kind of started with people in the military because of everything that they've seen in war and really traumatic events. But anyone can have PTSD if it's, a really traumatic situation and, it really affects them. There are different types of therapy that can help heal from this so that it's no longer impacting them in that way. Neurodevelopmental disorders are like ADHD, autism, eating disorders, any type of problems with eating. Like I said, once it's to the point that it's affecting your daily functioning, that's when you're able to be diagnosed with any of these disorders. Schizophrenia, that one is one that starts in the early 20s, and that one can be a lifelong thing. But another important thing to know is that with schizophrenia, you can have similar symptoms when another mental illness gets very severe. For example, depression. So if you have a depression that is just not treated and it just deteriorates, it gets worse, that's when you can start to the point that you might hallucinate, that you might be hearing things, and those are the things that are seen in schizophrenia. So it's important to take care of your mental health, because your mental health can affect your physical health. Interchangeable mental health, sometimes, like somebody said, trauma, that trauma stays in our body. If we're not dealing with it, if we're not talking about it, it's important to find ways to let it out and we'll be talking about that more. Any questions about this so far? So I'm not getting anything in the Q&A right now. Okay. So conduct disorder is one that happens in the teenage years. And again, you know, that behavior as teens, is it serious enough to be a mental health diagnosis, or is this just, you know, part of hormones and changes and everything? Okay, so some factors to consider. Genetics, brain chemistry. So these are some factors that can lead to a mental health disorder. Genetics runs in my family. Brain chemistry, I don't know how familiar you guys are, like vitamins, vitamin D, or just not eating the right nutrients. All that, you know, affects our brain, our stomach. So there are some hormones that make us feel good, and those hormones, a lot of them are created in our stomach, or some of them. So what we're eating is going to play a big role in how we're feeling. So this is how, you know, brain chemistry can impact our mental health, and that can become mental illness. Intergenerational trauma. Has anyone heard about intergenerational trauma, or how our genetics play a role in mental health? So intergenerational trauma, or also called generational trauma, is basically what has happened in our families. One of the big ones is maternal grandma. So whatever your maternal grandma has carried, whatever she's gone through, is going to impact you. From the time that she was pregnant with your mom, your maternal grandma already carried you by when your mom was, you know, having her reproductive organs, you know, everything inside is really interesting how things just get passed on. Sometimes you might not know, why do I feel this way about this certain thing? It could be something that your grandma went through. So that's why it's important to seek help, or to just talk things through. Sometimes we think, well, this happened to me, but it wasn't a big deal. We don't really know how things affect us until we, you know, explore sometimes in our family. So like it says family history, nobody talks about feelings or don't cry. You know, there's all these different things that we hear that teach us to kind of ignore some of the things that have happened to us, or certain emotions. We don't want to have, we don't want to feel angry. We don't want to feel sad. So pushing all those things away can kind of perpetuate that cycle of intergenerational trauma. Well, my grandma didn't speak about her emotions. She didn't speak up. My mom didn't either. So then I shouldn't either, or I don't know how. So that's a really important one, that sometimes it's not necessarily, you know, a mental illness that I was just carrying, or it just happened out of nowhere. Is it just kind of keeps getting passed on because nobody is healing from it or talking about it. Family histories, very similar, what they have gone through. But also, if you have family members that have had any mental diagnoses, depression, anxiety, if you grew up with a mom that has anxiety and is always telling you, be careful, or, you know, kind of, I don't know how you guys grew up, but if there was anything like, this is scary, or watch out for this, or watch out for that, or this could happen to you. Those are things that, yes, genetically, you know, it can be passed on, but also by the way that they talk. So if your mom is very, you know, careful or worried, it can pass on to the child as well, just by seeing and listening to the conversations. just like eating disorders, the way that, you know, parents talk about their body, if they're happy, if they're not, if they're vocal about it. So a lot of things like that are learned simply by observing. Traumatic experiences, we talked about that, how different things that we're not at fault, things could happen to us, and that can lead for us to become depressed or have anxiety or have post-traumatic stress disorder. So it's important to know that mental health, anyone can have mental health, you know, illness, or, you know, not very good mental health at some point. And the thing with the stigma that we are talking about is that if nobody wants to talk about it, or if people don't feel comfortable going to see a therapist, or just like I said, talking about it, then they keep it to themselves. And what does that mean? If you keep it to yourself, you might not realize your best friend might be going through something similar. Or, you know, you might realize, oh, I'm not the only one that has had these feelings, especially after those years with the pandemic, not being able to see anyone. You know, there's a lot of things, a lot of ways that we all have been impacted as a society. Life stages, that's just a normal part of life, right? Like I said, you're a teenager, then you're an adult, then, you know, if you go to school and then looking for a job or getting married, or when your kids leave to college, the emptiness. So there's a lot of different stages that simply because of the transitions, because of adjusting to things, that can lead to mental health if it's not well taken care of. I didn't mention one of the diagnoses. It's called adjustment disorder. An adjustment disorder is a diagnosis that is given when someone has had something happen in their life within the last 6 months, loss of a job, there was a divorce, anything like that. And then you start showing symptoms of anxiety or depression, or sometimes in kids, it can be behavioral problems. So this is not, you don't fully fit criteria for anxiety disorder or depression because something just happened, and it's normal for you to struggle. It's normal for you to feel like not, you know, getting up, you know, so it is a normal part. So you're showing these symptoms, and that's a diagnosis that you can get. It doesn't mean that it's one of those lifelong diagnoses. It's like, it's a rough patch. I'm going through this and I'm going to get better. But of course, with the right help, with, you know, for some people, it might mean medication. For some people, it might mean therapy. So I think going to the next, to just kind of explain it in a visual, mental health and mental illness, how they're separate. So mental health can fluctuate between good and poor, just like what I'm saying. Something happens, okay, I'm kind of struggling a little bit, but I keep going, you know, I got some help, I went outside, I exercise. So it can just fluctuate. Mental health, we all have mental health. Mental illness is constantly present during, you know, like I said, you can recover during that time of, okay, I'm diagnosed with depression, I'm going through a depression right now, it's present. So that's a big difference right there. That mental health kind of goes up and down. Just because you're having a few rough days doesn't mean it's a mental illness, but it does mean like, hey, I need to do something. I need to take care of myself. So that's how your body kind of lets you know you need to do something. Any questions so far? Okay, keep going. So some of the warning signs, things to look out for. To keep it simple, I can say changes. Any changes in anything are pretty much kind of like a, hey, you know, kind of letting you know something's up. So pay attention to that. If you used to always sleep a certain amount of hours, but now you can't fall asleep, or now you're sleeping too much. So changes in sleep patterns, appetite, maybe now you're just never hungry, you just don't feel like eating, or now you're just eating a lot, you're really hungry. Your mood, maybe you're just feeling more down. Even if you're just feeling suddenly extra happy and that's not usual for you, that's the key. So knowing yourself, knowing your loved ones, and if you notice that something is, you know, changing, not their usual, that's a warning sign. Concentration levels, maybe now you just can't focus the same as you used to, something to look out for. Interests, so maybe you used to love going dancing, or you used to love playing a certain sport, but now you're like, what's the point? Or you might go, but it just doesn't feel as fun as it used to, so your interests change, or you just less interested overall. Same with energy levels, you might be feeling very lethargic, you just don't feel like doing anything, you're just more tired. And this can impact you. Maybe you used to work out a lot. You go, you know, to the gym, yoga, now you're not. So those are things to look out for. I mentioned earlier your performance at work or at school for students. You're just not doing as well as you used to. Something's going on. Personality, changes in personality and behaviors. So for kids, for teens, for adults as well, like if you're more irritable, for kids, it might seem a little more obvious if they're acting out when they didn't used to. Big changes in personality. So any type of changes, I'm not going to say that this means now you have a mental health disorder or diagnosis. It just means, okay, I need to pay attention, something's going on. So why not? You know, why not, you know, seek help? Maybe nothing's going on, or maybe it was just like a low, and why not learn some tools? So it's important to be able to know this and share this with your loved ones. I know not a lot of people are here, maybe more people will watch this, but just remember this part, because like I said earlier, 1 in 5 will have a mental health disorder at some point in a year. That means, you know, right now, if it's 5 of us here, 6 of us here, at least one of us is struggling or will be struggling. So it is that common, just like substance use disorders, just like anxiety disorders, which is one of the most common ones. I think for anxiety, it is also 1 in 5. So it's something that affects all of us, because even if I'm not struggling, but my friend is, or my family member is, it's going to impact me in some way, because maybe I worry about them, or maybe their relationship is just not the same. I see somebody typed something. Yes, it says, I know for me, if I don't get any exercise for several days, my energy decreases and my mood is impacted, for sure. So it's interesting how it kind of all relates. One, you might be feeling down, so then I don't want to work out, then your mood is down. So, you know, that can throw you into mental, you know, low mental health, poor mental health, but also the other way, you know, you are struggling with mental health, so then that leads you to not want to work out, you know. So that's why we will talk a little bit about self-care, coping skills, and ways to kind of keep taking care of that mental health, because again, we all can have any type of diagnosis at some point. We can all have really good mental health and not so good mental health, but the key is the balance. So yes, exercise is very important, but if we don't exercise, our bodies might hurt more, we might feel more tired. Any thoughts or questions about the warning signs or anything? Okay. I'll keep going. So I wanted to share this resource. This is a website from Mental Health America. You can just Google Mental Health America screening, and they have a list of screenings, depression, anxiety, all the different mental health disorders. Of course, you cannot diagnose yourself, but just like I said earlier, that now they're recommending children as young as 8 to 18 to have a screening for anxiety, or 12 to, I think it was 18 as well, for depression. This is somewhere that you can go, and it's kind of for yourself. You can always be curious, let me take a mental health screening, or they have specific disorders on there that if you're just curious, or maybe you're worried about someone, it's something that can kind of give you a response right there for you to say, okay, my numbers are a little bit high, or some of the responses, I think I should go talk to someone. So again, this won't diagnose you. This won't, be the solution, but it's kind of like a help to see where you're at. Thanks for sharing that. So that will be in the chat as well, the link. Okay. So talking about intervention. So intervention is, okay, yes, now I'm struggling, or yes, now I'm having all those changes. What do I do now? It's important to know that there is hope. There is help. There are ways to get better. And that is the best part, that we can get better. And these are some of the things that you can do. Psychotherapy is talk therapy. So going to a therapist nowadays, you can do virtual therapy, you can go in person, whatever feels right for you, or busy schedule. Sometimes, okay, all I can do is like real quick, join my session. So with psychotherapy, there are different types of therapy. I just listed a few here. Cognitive behavioral therapy is one of the most common ones. It really looks at the way we see things, our thoughts, the way that I'm interpreting a situation. So it kind of teaches you to question your thoughts a little more, instead of just going with the immediate negative thought that I had when something happened. It allows you to pause and say, well, what if it was this? So that's one of the most common ones. Dialectical behavioral therapy started for people that really struggle with mood, that they might have like really, strong mood swings, struggle regulating their emotions. So this teaches them mindfulness, different techniques called distress tolerance. So for distress tolerance, the moment is stressful. So how do I tolerate this moment? So how do I tolerate this distress right now? That is it's part of the umbrella of CBT, but it's another type of therapy. EMDR therapy started for PTSD, the one I talked about earlier, when there's a lot of trauma. EMDR therapy, even though it's a psychotherapy, a type of talk therapy, you don't talk a lot, because it really looks at traumatic experiences that you've had. And it's basically with your eye movements. It's like allowing your brain to kind of process everything on its own. It's a really cool experience to see and to experience. So if you guys haven't tried it, it's something good to try. It says it works great. So thanks. Looks like someone has tried it. Brain spotting is a little similar. It also targets trauma, different type of mental health disorders. And I've heard that it can be a little bit faster than EMDR at some point. So just depending on what you're looking for. ERP, exposure and response prevention, is more specific to OCD, obsessive compulsive disorder. Medication management. So there is the option of taking medication. For medication, you go to a psychiatrist or a psychiatric nurse practitioner. Some people go to their PCP, to the regular doctors. I always recommend going to a specific psychiatrist, psychiatric nurse practitioner, because they have the specialization in mental health. So they actually follow up with you. They look at the side effects, they follow up. And with a PCP, they might just say, like, take this, you know. So for some people it works, but there might be something out there that might work better. Maybe they don't have to be taking it for a long time. I know people that have been taking the same one for years because the one doctor mentioned it, you know. So it's just kind of taking a little bit more control over your life, your mental health. And there is research that says that medication and psychotherapy together is the best result. So being able to do both together brings the best results. Somatic therapy, yes, I would say it is a psychotherapy as well, but somatic therapy focuses more on the body. So teaching you to know, what does anxiety feel like in my body? How do I regulate that anxiety? So again, some people just choose to try psychotherapy. Some people want to do both. There's no judgment in either one. Again, medication also, it does not have to be forever. It might be something that gives you that little push that you needed to attend therapy or to start exercising again. So everyone, depending on their needs, these are some of the options. And the goal is for you guys to feel comfortable to talk about it. I know, you know, nowadays some people are comfortable enough to say, like, oh, my therapist said this, or, oh yeah, I have a therapist. And I love when I hear people talking that way, because it just normalizes therapy and just mental health, not necessarily mental illness. It can be mental illness, but it's a mental health. I'm not doing so well, so I'm going to my therapist, or I'm doing so well, but I'm working on trauma. Because sometimes when we are going through a really rough time, it's hard to dig deeper into other traumas, or, like I said, generational trauma. But if you're doing better, that is a time that you could explore more. So I see I have used many different therapy types, which has helped significantly with my mental well-being. Thank you for sharing that. Yeah. So, you know, being able to see how the different types of therapy works is great, because maybe one works better for you, one doesn't so well. So it's good to be open and just try different things. So I mentioned intervention. This I'm mentioning prevention. I always like to use those two terms, because intervention is when something already happened. You're already struggling, or you're already at your lowest. So the goal is to focus more on prevention. What can I do every day to prevent myself from getting down there? What can I do every day to take care of myself? The first one is self-care. That's the everyday. So I want to ask, for any of you that know what it is, what do you already do for self-care? Do you guys have something that takes care of yourself, your mental health? Just feel free to share it in the chat. And okay, I see somebody wrote meditation, walking, hiking, drinking lots of water. Yes. So self-care, any physical activity. Self-care could be anything. Sometimes self-care is, you know, nowadays, oh, my bubble bath or my massage. It feels like it has to be fancy, but it doesn't have to be. Going outside, time in nature. I really need to call the doctor and make that appointment. I'm gonna do it. I need to make my bed. Sometimes it's not so fun. Sometimes it's fun, but it's just the everyday things that you do to take care of yourself. Having hobbies is important. Not everyone has time, but could you make time for something? Music, having something that just makes you feel good, something that makes you feel happy. water, drinking a lot of water, somebody mentioned. So water is something that maybe we don't think about, but when we're dehydrated, that can put us in a bad mood, just like eating. I don't know if you guys have heard the term hangry. If you're not eating well, you're not going to be in a good mood. So eating the right amounts, eating healthy, sleep hygiene is very important, making sure you're getting the amount of sleep that you need, having a nice bedtime routine. So those are the things that are simple, are needed, and we might know like, oh, I know that, that's normal, that's every day. But are you really doing that intentionally? Okay, I have this bedtime because that's what I'm trying to do. I'm trying to improve my sleep hygiene. Or I'm trying to eat more greens, you know? Like I said earlier, what we eat can lead to anxiety or can help us with anxiety. So self-care is that everyday thing that you do to just keep going, to just release a little bit of stress, to just keep going, to just show up. That is self-care. Coping strategies. So coping strategies can be prevention, but also intervention, because coping strategies are what we do when we're nervous or we're stressed, or maybe you're at the doctor's office and you're not feeling too good and you don't know what they're going to tell you. So one of the examples that I will share is called grounding technique. There's different types of grounding techniques, but I'm mentioning one. Basically, engaging your senses. So what are your senses? Type in the chat. I can say one, hearing, touch, seeing, taste, smell. So using your senses, basically you're grounding yourself. If you're anxious, you're up here, you're not really thinking. So visualize kind of like I'm putting my feet on the ground. I'm coming back to the present moment. So your senses can really help you with that. The 5, 4, 3, 2, 1 technique is basically what are 5 things you can see? So look around your room. What are 5 things you see around the room? Okay, I see my water, I see a pen, a marker. So kind of naming the things that you can see. You can say them out loud. You can say them in your mind, but you can also, there's another one where you can do green. Okay, I'm going to look at all the things that are green. So let's say you're at that doctor's office. Okay, I'm just going to focus on all the green things around the room or all the squares in the room. So that's like bringing you back to the present. 4 things that you can touch. Okay, I can touch my highlighter here. So what are some things you can touch? And just using that sense of touch. 3, what are some 3 things that you can hear? Oh, I hear someone's voice. I hear footsteps. I hear the clicking. 2, what are 2 things that you can smell? Okay, my lotion, my perfume. 1, what is 1 thing you can taste? So you might not always have the taste, but it's giving you things to basically remember where you are, just kind of focus on the moment, distract you a little bit. And that one for grounding, you can do, like I said, with your eyes, finding a certain color, shapes, textures. So if you have something and you can just feel it, observe it. I don't know, you guys have seen the scrunchies. So kind of like having something to give you just that sensation, you know, so it kind of brings you back to the moment, which can work really well for people having an anxiety attack or panic attack. So having anything that will bring you your senses here and present. Deep breathing. One of the easiest ones that I can mention is called box breathing. And it's called box basically because it's a square. So if you can see on my slide, it's 4, 4, 4, but it's 4, imagining that each square has 4. You know, if this was 4 centimeters, 4 inches, you're basically counting till 4 as you are breathing in with your nose. You hold it for 4, and you breathe out through your mouth for 4. Then you hold again for 4, and you just repeat that a few times. So that's one of the most simple, straightforward ways to start practicing breathing techniques. Once you're comfortable with that, there's more, it's longer, but this is a great way to start practicing breathing. Challenging your negative thoughts. I talked about that with the CBT, cognitive behavioral therapy. Basically, something's telling me something bad, like, oh, maybe I'm not smart enough. Well, is there something that can tell you otherwise? Well, I mean, I went to school and I graduated with this or with this grade, you know, anything that can basically challenge a negative thought that you're having. Challenging. All the thoughts that we have are just thoughts. You know, it's just information. Sometimes it's just your brain putting things together. So realizing we have thousands of thoughts in a day, I'm not just going to listen to that negative thought. I'm just going to push that one away, or I'm going to challenge it by saying, no, I am good enough. I am smart enough. Any questions about self-care or coping strategies or anything else you want to share? If there's any coping strategies that help you or that you've heard of you have used. Hopefully these are helpful.
Yeah, one of the things I learned in my positive intelligence training when it comes to touch is I don't know what it is, but just gently touching my palms with my fingers really slowly. I don't know what it is, but that is just like, it instantly calms me.
Yeah.
So it's really super helpful to get these. And the breathing piece, I do 4 in, 8 out.
Nice.
With a middle, with a slight pause on either end of those. So I mean, there's so many different breathing techniques and coping strategies out there, and I think, you know, it's really important to try different ones so that you can really figure out what works best for you.
Yes.
Yeah, these are great.
Thank you for saying that, because yes, I was going to mention these are only a few. There's so many out there, and the good thing is there's so many, and one might not work for me, it might work for you, but that's what it's about. It's about figuring out which one's going to be the best one for me, and just because this one didn't work doesn't mean others can't work for me. So just kind of being curious, exploring, trying things out, knowing that there will be something out there for you. Thank you for participating. So to just recap, mental health basically is what we kind of started with. Everyone has mental health. It can be amazing. It can be not very good. There is that balance of sometimes it goes in waves. And if we don't take care of it, or just for some people, genetically, mental illness is there, but there is help. There are ways to manage mental illness. There is mental wellness. So there is that moment where mental health, the more you're exploring yourself, the more you're learning, the more you are thriving, you can be in that mental wellness part of yourself. So always, you know, strive to be better version of yourself. And just remember, if it goes down, it's okay. It can come back up. I added some resources on here. If you do want to find a therapist, or find a therapist for a family member, loved one, friend, Psychology Today, Latinx Therapy, Inclusive Therapist. Open Path Collective is for those people that maybe don't have insurance. they can't afford therapy. Open Path Collective is a group of therapists that are offering a sliding scale. They kind of made a contract, or kind of like I'll take at least 1 or 2 clients from this website that are needing, lower fees for their therapy. So hopefully these help. And you can share them in the chat too if you have them. I wanted to mention the 988. I don't know if you guys are familiar, but I think this year, this number went into, it actually started working. The suicide prevention line used to be a long number, 1-800, and people had to, call. And there's also the regular crisis, the local crisis team that comes out in case of any emergencies, or maybe someone that's struggling and they need to be seen at their homes. Now, all you have to grab your phone, and click 988, just like, there's 911. 988 is specifically for mental health. If you have any question, if you're struggling with thoughts of hurting yourself or somebody that you love, you're worried about, you can call this number, ask questions. So it's nice that it's a simple number that you can share and it's easy to remember. 988. Any questions? And that's it.
Thank you so much, Denise. This was really amazing. I did not know about 988, so that was really super helpful. And for those attending and watching the replay, I really am a true advocate for mental health awareness. I have utilized a variety of different therapists. As a matter of fact, today I just went to my somatic therapy appointment right before this meeting for trauma that I have trapped in my own body from childhood and other factors. And I can't say, enough about how much it's really important to find somebody who is the right person for you. So you can,
yes,
definitely, it's like a doctor, right? Not all doctors are the same. So if you do try one and it doesn't feel like it's a good match, try somebody else. It's really important to find somebody who's got the right connection, and who's right for you as well. And there's so many different ways to find a variety of different therapists out there.
Yeah.
Even ask your friends, right? So the more we can ask our friends, the more we can destigmatize that whole mental health topic around, how's therapy going? And you don't have to get into the details, but what's the impact it's had on your life?
Yeah.
And I know it's had a really huge impact for me to be able to have better emotional regulation, releasing old traumas, changing that soundtrack that I play in my mind. So there's just a lot of great things that come from really talking openly about mental health. So thank you so much for all of this.
No, thank you so much for sharing this, because in bringing this point of therapists, sometimes it's sad because I've heard people that say, I had a really bad experience when I was younger, so I never wanted to come back. So now I'm finally going to try it again, so know that there's a lot of therapists out there. Your therapist won't be hurt if you just didn't feel the connection, because the right one will be out there for you. And the research says that the connection you have with your therapist, it's also a big predictor of you doing well in therapy. So the part of the treatment is that relationship that you have with your therapist. So don't feel, bad if you're wanting to change. I know that can be a hard thing, especially for people that are maybe struggling with being more assertive. They don't want to hurt someone's feelings, but this is for you, and I'm sure your therapist wants the best for you. So if that's not them, it's okay. Just keep looking out there, but the right person will come. Thank you so much for sharing that.
Yeah, absolutely. It's so important. I think, to this day and age that we all really understand, what might be holding ourselves back
Yes.
and how we project that out into the world. As we collaborate, work, and lead, it shows up in every aspect of our life. And who doesn't want to feel really good all day long,
Mhm.
right? So it's super important.
Thank you so much.
Yeah. Any last questions from anyone? All right, then. Okay, well, thank you so much. I really appreciate your time today. Thanks for spending the last hour talking about mental health and learning more. Hopefully, this was really helpful for you. So, have a wonderful day, and we'll see you on the recording.
Bye.
Bye
Thank you.
bye.